And so I want to return to the question I started with a few seconds ago. Now that you've heard these wonderful actors going for broke, leaving their vocal cords on the table, and you've heard this wonderful group of panelists and experts making such personal and insightful connections to this play written 2,500 years ago, and you know the play was written by Sophocles, and it was staged for 17,000 Athenians in the center of Athens during the 5th century. What do you think this guy Sophocles was up to when he wrote this play? What was his objective as a human, as a playwright, as a citizen, as a priest of the god Asclepius, the god of healing? What was he trying to do? What was his objective? Now, in every audience, no matter how large or small, whether we're on a public square, a hospital, or in a theater, there's always one very kind person, usually very attractive. Oh, I knew it was you all along. Who puts us all out of the misery of a long silence, and I'm going to give it to you, sir.
It seems to me, very briefly, that what he was attempting to do is what you all are talking about. 2,500 years ago, the issue was identical to the issue that we're dealing with, and I think that's what he was getting people to debate, the end-of-life issue that we in this country and this world seem unable to debate. So I would say that was the purpose.
Yeah, this was about civic discourse. It wasn't simply entertainment. It was about bringing this issue to the fore and giving a common language for everyone in the audience, no matter what their political position or feelings might be, to have a stake in it. I think that's definitely part of what he was doing. Anyone else want to take on this first question? Yeah, making my job so easy in the front row. Thank you.
I was Yeah. I was just impressed with the complexity of the end of life that I saw in the play, the complexity of that surrounds it, and that's certainly universally true, yesterday and today.
Yeah, thank you. I feel like Sophocles' plays are plays in which everyone is right or feels they are right, and someone's often going to die. And so he gives us these perspectives of people fighting for what they believe in, and you see the complexity of the issue play out before us. It's not black and white. It's extremely gray. There was a hand over here, and I hope we didn't kill it. Yeah.
I thought that as a playwright, one of the things he wanted to do was to represent the degree of suffering and how it affects the people who are nearby, just to, kind of fully represent what it means to be human at a time like that.
Yeah, I presume that all of us in this room were uncomfortable during the screams, so he gives us this shared experience of discomfort to acknowledge this is what it's like. This is the truth of the experience, even though this is drama, and even though in that time they were wearing masks and doing these stylized gestures, this captures some element of the truth of the experience. Now, there are microphones in the back, so all you have to do is raise your hand and not be bad students just because you're in the back, and the microphone will come to you. Yeah, sorry, I didn't mean to say a pejorative word about you all in the back. The mic is going to come to you, and anyone else wants to take, there's a hand over here as well, Lauren, so I think we need a boom mic.
Yeah.
You want to get over there?
Brian, while we're reading...
Yeah, please, yeah.
Yeah, so while we're reading, what do you think Sophocles would say today?
Well, it's unclear. Sophocles' politics, he was definitely a pretty mainstream Athenian. There is some thought that he was a priest, I keep saying this, of the god Asclepius, the god of healing, the god of doctors. The Institute of Medicine symbol on the front of your program is taken from that very cult, the snake, the serpent. I have my own theory. Since you opened a space, I'll say it.
Yeah, you wanted to be personal.
Yeah, sure. No. In the ancient world, one of the most formalized forms of medicine was song, and the Greek plays were all sung. Song was like antibiotics. Paean, the song, means healing song. You hear the song. In the late 5th century, the temple of Asclepius, the god of healing, was moved to the very edge of the south slope of the Acropolis, right next to the Theater of Dionysus. I went there a couple years ago at dusk, and I stood in the remains of the temple of Asclepius, and I could hear the docent down in the orchestra pit, speaking on her cell phone with the clarity as if I were listening to her with Bose headphones on. And all of a sudden I realized I'm standing in the clinic and I'm hearing the voices of the orchestra pit as if they were in my bedroom. The theater was an extension of the medicine that was coming into the clinic and vice versa. So I think Sophocles, when he says, "Be my doctor" in the text, there's a number of things being said here, and there's a wholesale public health, not just message, but treatment that's occurring.
Was that a HIPAA violation, by the way?
Possibly. There was a hand over here in the microphone. Yeah. We've vamped long enough down here. Yeah.
I thought broadly that one of the things Sophocles was trying to say was, what are our obligations as a human being to another human being? Yeah. In particular, when that other human being isn't so nice. Yeah. And also, what are the obligations of a son to a parent? So it was a very broadly stated question about obligation. Yeah, absolutely. You know, there's a theory that Greek drama was a form of ethical education for late adolescents. That's why in so many of the plays there were adolescents, Electra, Orestes, Pentheus, Neoptolemus, the list goes on and on and on. 17 or 18-year-olds who, like Hyllus, were thrown into these ethical situations where no matter what they did, they would be wrong. And I get the sense that father-son obligation, that question, it's about preparing them to be citizens. If you believe this theory, it's just a thought exercise, and I'm not really an academic. If you believe this idea, that young people watching this were being prepared for the moment, that nothing could ultimately prepare them for, which is when they'd be asked to do something like this by a parent. Yes?
I also thought that he was trying to help his son not feel guilty.
Yeah.
Because of what he was doing, that the decision was his and he needed help. Yeah. And you always have that feeling that maybe you made a mistake. Yes. And he wanted him to know that this was right.
Yeah, so if I hear you correctly, he was saying not just the son, but by proxy, all of the people in the audience at that time who had been in that position, and presumably if 30% of the population of Athens by the time the play had been performed had died of some kind of plague, most people in the audience have been in this position or been near screaming people. But you're not alone. You're not alone in your moral and ethical discomfort. It's not an academic question, it's a human question. You're not alone in feeling that even if you knew you did the right thing, at being haunted by the fact that you might have done the wrong thing. There was a hand right here.
I thought it was interesting that Hercules said, "Bring the woman to me, I want to kill her." Yeah. And he asked his son to kill him, and his son has more compassion. And there was a question in there of the gods and leaving it to the gods and all that, but that Hercules he was fine with it. I'll kill her, you kill me. Yeah. There wasn't any question for him.
There wasn't. And he had that sureness that, I think it's worth just mentioning, and I appreciate you bringing it up. I'm going to. There's a hand right here. Then I'm going to shift to my second question. You can always answer the first question third or fifth. You can make up your own question and answer it, but I'm going to keep moving through some questions.
I'm a pastor, and I've often been called to people who are dying, but I didn't understand the last sentence, the last line in the play, whether they saw God and who to them was God, because I have patients. I have people that I've visited who feel they have had an experience of seeing Jesus, that type of thing.
Yeah, thank you. I'm going to let that float because I'm going to come back to it as one of the final questions, but it's definitely something for us to all think about. If Sophocles was a priest of the goddess Asclepius, then he was in many ways perhaps a chaplain. He was engaged in spiritual discussion or religious discussion with his community as well. The theater was part of a religious ritual in which a sacrifice was made. The festival itself was indoctrinated by all kinds of ritual processions that were part of the basic religion of the Athenian. And Heracles was worshipped as a god as well, which goes beyond. Heracles by the way, gives his invincible bow and arrow in a variant of this myth, this other guy, Philoctetes, who lights the match. And this is another play that we do, but it's connected in a larger mythological structure. I'm going to shift to a second question. It's about A common response we hear from medical professionals when they see this play. Oftentimes when we perform this play at a hospital or a medical school or in any kind of medical setting, I can see a lot of doctors very uncomfortable or nurses very uncomfortable in the audience, and one will inevitably raise his or her hand and say, I just wish I could have gone up and given T. Ryder Smith a shot of morphine. Because we have the tools to deal with this kind of pain, and it's really hard to sit here and listen to it. So my question for you is this, because I've heard this everywhere we've gone. Would morphine be of assistance to this character at this moment? Sure. Could something also be lost in the administering of morphine? What is gained and what is lost? What would be your decision in terms of the use of morphine and how much? Is this a good thing? Yeah, there's a hand way in the back, a couple hands way in the back. Lauren, all the way. Oh, sorry. I might have to, here, I'll do it. Now I feel like a game show host all of a sudden.
Hi, I am a physician, and my first response was, wouldn't a little morphine help? Yeah. But then when they touched hands, it occurred to me that, closure is such a 21st century word, but the two achieved closure. He didn't need morphine anymore. He just needed his son close to him, and they needed to have a conversation about what the facts were. And isn't that what we need?
Yeah, thank you so much.
I just want to say, Pat Bomba, Jim Collins, I thank you so much. Pat has done so much work in New York State with the MOLST form to get to this point, to have these conversations, to force guys like me to have those conversations with their patients and the families, to have conversations with their loved ones. Thank you, Pat, so much.
I'm going to keep working this side here. There's a hand right here.
I am a nurse, and I've given that morphine. And I've been there with that patient whose family couldn't get there, and I've held their hand as they died. And it is extremely spiritual and amazing to be with a person when they're going through that. But it's also a big decision that is placed on me because the doctor isn't there. They've given me the order for the morphine, but I know that that patient is not going to be able to breathe anymore. I know that it's going to be the end for them. And even though I know that they need it and I'm going to give it, it's an incredible burden that you feel when you're put in that position. That's all I have to say.
Thank you. I really want to acknowledge this because I think it's really important, just from my experience caring for someone who was close to death. Giving the morphine can be like lighting the match. And there's something in medical profession which everyone on the expert side knows called the double effect, which was obliquely referenced earlier, where you give someone who is dying a morphine because they're in pain and it precipitates their respiratory failure. And that's the one sort of legal way in most states where it's not legal to aid in dying, where aid in dying occurs in the closet in some ways. And it's an immense pressure to put on a nurse when the family's not there to be responding to someone in pain, knowing that you might be lighting the match. Thank you so much.
My mother was a nurse. She was a very devout Catholic, but she said as a nurse, her job was to ease the pain of the patient, even if knowing what the final end result is going to be, the job is to take care of the patient.
Thank you. There's a hand over here, yeah. I'm glad I didn't get my exercise today, and now I'm working on the back here.
We had a family experience where my father-in-law had Lou Gehrig's disease and was on a ventilator and made a very deliberate decision that he didn't want to go back on the ventilator and found that he couldn't get somebody to write the order to keep him from being on the ventilator. And I'm a physician and his sons are physicians, and ultimately he had to make the decision on his own. I refused to go back on the ventilator. But that's the background. He had morphine and asked to have morphine, and it took him 8 hours to die through the day. And about 5 hours into it, he woke up just a little bit, and he said, "Did we start yet?" And we all said yes. and he just eased into an incredible calm. But I was just profoundly touched when you were talking about the son not wanting to light the match. My brother-in-law didn't want to give any of this morphine that goes under the tongue. And I couldn't understand that because I saw it as the last protection that he could give to his father. And I realized, actually through this play for the first time, it's 10 years ago this happened, that it really, that lighting the match of the parent may be a very different thing. And I wonder if as a healthcare system, we've got to have some people to help light the match, but not take the need to, or you can't have the statement of, I can't decide to light the match, but the healthcare system may have a responsibility to ease the burden of the son in the play, metaphorically, of doing the lighting.
Thank you so much. I really appreciate that. And the son says, what do you want me to do, Father? Be your murderer, hounded by furies forever? You know, in the ancient Greek world, if you killed a parent, like what happened in the Agamemnon where Orestes kills Clytemnestra, you're hounded by furies. That's an actual, that's what they imagined would occur, whether that's psychological or it's true. Not lighting the match is a huge decision. As someone also whose father recently died, my father recently died, and when he got to the point where he had dementia, he's 66 years old, the doctors came in and they basically said, there's nothing more we can do. At Johns Hopkins was an amazing place, and then all of a sudden the doctors left, and we're having this sort of ethical conversation with a social worker, and then we're on our own, right? And that wasn't the doctor's fault. But it's something we have to talk about in terms of the system and how it works, because who is hurt more in that equation? And what are the long-term repercussions for people who understand the ethics or don't even understand the ethics until it's far too late? There was a hand over here, yeah.
My son was a victim of suicide. And one of my real regrets is not being with him at the end. He disappeared before we heard he took his life. And we knew he was troubled and knew he had talked about suicide, but my one regret is I wish I would have been there with him and had that opportunity.
Thank you so much. I really appreciate you sharing that. I know that's not easy. I'm gonna shift to a third question, and I'm gonna keep things moving. I apologize for shoving us down a 90-minute tunnel, but the third question is this. In the actual Greek text, and I translated this from Greek, this is my translation, coming out from Knopf in a year, if you'd like to buy it. And the title is All That You've Seen Here Is God, of the 4 plays that will be coming out. Shameless plug. In the play, the actual Greek text, there's more screaming than what T did, if you can believe that. So the screaming goes on for an aggregate amount of 15, 20 minutes. Why in the world would Sophocles gather 17,000 citizens in the center of Athens and have an actor like T scream at them at the top of his lungs for 20 minutes? Was this entertainment? Why did he scream so long in the ancient Greek text? What was all the screaming about? What was this guy Sophocles up to? What was his objective? There's a hand over here. Okay, sure. You got a mic? Yeah, right there. Thank you.
I'm a little biased as a psychologist working in geriatric medicine, but my answer would be, and as Dr. Cassel actually was explicit a minute ago, pointing out that suffering is both psychological and physical, healthcare delivery has dichotomized that, but as we've all seen today, they're not separate, so I'd put that out there.
Right, so the screaming is obviously, the longer you listen to it, the more it's clear that it is not simply a scream of physical anguish, if I hear you correctly.
So there's probably no limit to the screaming adequate.
Yeah, no, and I've had people stand up in our performances and say, the scream is obviously a metaphor. This length of it is a metaphor, and it's a scream that we don't necessarily always hear. It's the scream that is inside of people, regardless of whether we hear it or not, whether they're on morphine, they're not. There's a hand over here.
I want to think that what he's yelling and what the actor's yelling is that we need new gods.
I know this was originally a spiritual community and maybe still is here in Chautauqua. Well, I think if I understand what I think he's saying is, I actually hadn't heard it until I've heard this play maybe 40, 50 times. I directed a full production in California. Until this performance, I didn't hear Alex's performance today when you said, look upon a man that the gods once called a son. See how they treat him. Mm-hmm. Right? And I get the sense that there's a young man who is now shaking his fist at the sky. And that is a human impulse. And whether we agree with it or not, it's a human behavior that we recognize sometimes in ourselves and in others. So I appreciate you raising it.
Brian, could I just go back to your question? So is the prolongation of the scream, which evokes tremendous pain, I think when we're listening to the scream, we feel it deeply. The longer it goes on, the more painful it is for us and more likely to evoke a response, which is to put it out or to respond to it in some way. Is that part of the Sophocles message?
Well, as I shared with you before we started, the note that I gave the actors, and unfortunately they didn't live up to their promise, was make everyone wish they hadn't come, make them leave.
No, I think they've done a good job.
I take all the credit for that part. But to my point really is simply, obviously it makes us profoundly uncomfortable to listen to him screaming, and the longer it goes on, the longer we wonder how long we can stay in our chairs. And as someone who's been present for a number of people that I've cared for dying and being in pain, my girlfriend had late-stage lung rejection after a transplant, and her lungs were scraping against the pleural lining on the inside of her chest, one of the most nerve-rich areas of the body, with every breath. Mm-hmm. And it was so inventively cruel a pain that it had to be divine from my perspective. It was beyond human intelligence to devise something this cruel. And I get the sense that Sophocles is saying, if you can't, look how hard it is for us to sit in this theater for 20 minutes.
Right.
Look how hard it is to be present when someone's in pain, physically or mentally. There was a hand over here, I think. Yeah.
I had attended a meditation earlier this week. It was a heart meditation, and there was a Sikh who was leading it, and we talked about the concepts of meditation and new ways of looking at it. And I had a little trouble moving through the first meditation, and he said, well, close your eye, everybody close your eyes for a minute. And he said, what happens when you evoke the word mother? And I sat there, and the tears just came. And I took care of my mother for several years. She had Alzheimer's and Parkinson's, and I cared for her 24/7. And we had hospice at the end. When the Sikh told me that I was still grieving, and I thought, well, this is 3 years ago, I'm not still grieving. And when I come here today to see this, I realized why I'm still grieving, and that is because I lit the fire. I was the one who lit the fire by myself with her. And it's been, I kept wondering, how am I going to get over the guilt? How do I get and I'm so happy that I came to this session, so thank you for the inspiration that you've given me.
Thank you so much. Thank you. Thank you for sharing that. I really appreciate it. I mean, clearly there's so many, you've lit up the board at this point. I'm not going to get through my other questions, but I clearly, one of the things that Sophocles is delivering to us is a notion of not being alone, because it's so isolating, it's so unknowable until you're there, and until you're facing those decisions by yourself, like Hyllus was in the play. And he brings 17,000 people, you're answering my first question for me, together, sit shoulder to shoulder to be collectively uncomfortable and to collectively shoulder the ethical weight of that decision. And also, I think most importantly, from what I heard from you, to grieve. And maybe that's what the screaming is about, to create a permissive place where that kind of screaming can occur. There was a hand over here, and there's a mic over here, and I've been instructed to, there's a mic coming to you. And I know I've lit up the board. Remember, you can always answer whatever question you want, but I'm going to keep pushing to another question after this one. Yeah.
I'd like to redirect
Please.
the discussion. Everything that you've talked about so far has been where the patient himself, the person, makes the decision or is faced with making the decision about end of life. But what about the many, many circumstances, I'd like to address this to the panel, where it's a family member who has to make the decision, where the patient is no longer able to function or to make the decision. What does the medical profession provide in that circumstance?
Would someone like to take that on?
I can start. I think that one of the things, it's a very difficult situation when family need to make decisions when there hasn't been conversation ahead of time. And it's not really about treatments, it's really about finding out what is the person's values, what are their beliefs, what's important to them, what are their goals for their care. And if they could sit up right now and talk to us, what would they say is important to them? That's probably the most important thing, because that's how it really unburdens, and we talked about taking away the family burden and being able to make decisions. Then once you've gone through that discussion, that's probably the most important piece. So it's important to take that away. It isn't about, is it going to be resuscitation? Is it about breathing machines? It's about what is important to that person. Then that can help drive the decisions. And I would suggest to everyone in this room to have a kitchen table discussion, because the sooner that you have that and you understand how that changes over time, it takes away family burdens. I want to address the last young woman who spoke, and I would say I took care of my mom for the last 15 months of her life. And at the end, it was those conversations that we had every Thanksgiving for many years, from the early 80s. And then she did have a Moles form, which is a medical orders, and those were very intense discussions over 15 months. At the end of the day, that helped me, but I wasn't a doc. I was a daughter losing her mom. And so grieving can take a bit of time. It's different for each one of us. But as Bryan said, it's important for us to grieve and to remember and to celebrate the life and to recognize what you did for your mom was so invaluable. So I hope that helps in your healing with being here today.
Pat, isn't it also true that person at the back who said that this can also be an important role of the physician or nurse or the team because of that feeling of guilt if you think you're the one that lit the flame or lit the match. And so very often people are not going to have the perfect circumstance that you've identified in that advance directive. But what you are going to be able to say is that this is what I believe she would have wanted, and this is how I treat her with respect, or him. And then to be able to help the physician to help that person so that they don't feel, too often this is such a legalistic discussion. So what's your mother want? Okay, that's what we'll do. Rather than really understanding the profundity and complexity of the situation and helping to share some of that burden.
Well, actually, it always has to be shared decision making, and it has to be where people would say, what would you do for if it was your mom? And I never had trouble talking that way, and to be able to take the burden, because at the end of the day, it's the underlying disease that's causing the death. It's the underlying disease that Heracles was suffering that was really causing the death. It's not really the match. It's the underlying disease. I wanted to make one other comment about the case and the discussion about the gentleman with the ALS. And the difficulty with the decision not to take away the ventilator. I think it's important for people to walk away and know that there's not a medical or legal or ethical distinction between withholding treatments or withdrawing. If we don't have the ability to take away, we wouldn't want to try. So being able to try something to meet what the goals are, for me, my goal for care is to be a grandmother. I'm not yet a grandmother, so life will be worth living when I'm a grandmother. And so, based on that goal for care, I may choose treatments to be able to meet that goal. But it doesn't mean I have to stay with that kind of treatment till the end. And so it's important for us to know we need to do it. And I need to comment on something you said as well, which is there's nothing more to do. That's a term that when I win the lottery, we'll get rid of, because there's so much we can do.
It all starts then.
Because there's aggressive palliative care and being human beings to each other, being physicians, being that doctor. So I don't like that term.
Agreed.
We want to give a lot of pain relief, symptom relief, and support families through the process.
Thank you. Do you want to jump in, Dr. Pizzo? Or,
I think well, these are profoundly important comments, and I think they've been so well enunciated. I just want to raise one thing that hasn't been on the table as much, and that is the medical community, physicians and providers bringing up the prospect for death for patients who are likely to die at some point. And this is a discussion that, unfortunately, we fail to do in the world of oncology that I live in. It is just way too common for oncologists not to raise long in advance the prospect of death and allow the person and their family to have an opportunity to really engage in this. And the second is, all of us in this room, as we know, we're all going to die at some point. We don't know when, but it makes sense for us to have these discussions before the illness arises. You know, if from my own case, in my own situation, my wife and I have had those discussions directly. We've had them with our daughters. We've tried to educate them for what we think is our needs. We know that they're likely to change over time, but we've tried to introduce them so that it doesn't get shrouded in this mystery of, uncertainty, but is really clear from the beginning.
Thank you so much. There are a couple hands, there are about 15 hands over here, but these two have been most forcefully raised for some time. I'm going to get these, and then I'm going to ask my last question because I don't want to go over, because I know you all are very punctual here. So,
I just wanted to bring up one other factor. I was head of pulmonary and critical care at New Jersey Medical School and worked in University Hospital in a critical care unit for many years. Many of my patients had no family support, and quite frankly, they were the most difficult to deal with because then it fell on to society. So I would urge people as they think about this problem, not only to think about it in terms of people who have support, but all of those poor souls who are without the support of family.
Yeah, thank you so much. It's a really great point. Thank you. I'm so sorry.
I just had that kitchen table discussion with my family, and I have just signed a living will and a life care proxy, which essentially says to all of my caregivers, my family, what's going to happen when I get to that point. My wife and I have both signed it. We've shared it with our sons, and I think this is something that possibly all of us should consider, because if we get into the situation where we are terminal, if you will, and nobody wants to make that decision to pull the plug on dad or to stop life, I think if we have that discussion with our family, it makes it much easier for them and much easier for our caregivers to make that final decision.
Thank you so much. Thank you. I know I'm offending about 10 people by going back here and asking my last question, and I'm going to be around all night. You'll find me on the veranda. I could talk about this till I'm blue in the face, but we were supposed to end at 90 minutes. So I want to get to my last question, and I promise it's my last. It can go many different ways, and you can ignore it and say what you want to say if you want to, but I really would love for someone to take this on. So at the end of the play, it was mentioned by the pastor in the back of the orchestra section. At the end of the play, the chorus stands up and addresses the crowd. And in ancient Athens, I imagine it that the chorus, as the intermediary between the play and the audience, the chorus as citizen stands up at the end of 3 plays, because this would have been 3 plays over the span of a day, followed by a comedy, which we all desperately need now. At the end of those plays, this play came last. This is all my pseudo-academic conjecture. I'm a director, so I can do this. So at the end of the play, the chorus stands up and he addresses the 17,000 citizens in Athens in the outdoor amphitheater that had the acoustic clarity of something we couldn't even imagine in this time, and says, "My friends, you've seen terrible things here today, new kinds of torture, immeasurable pain, and all that you've seen is God." What did that last line mean? What was that character, that citizen saying to the audience? What was Sophocles trying to do? What did that last line mean to you? And I promise it's my last question, and perhaps the hardest in a... Yes, you were waiting all along. I'm sure you'll fold in all of your answers into one question.
Maybe it means dignity. I think we strive our entire life for dignity, and I think in death we should have dignity. And every time I come to these places, I hear end of life and pain and suffering, and that shouldn't be. Why do we have to have pain and suffering? Why can't we die with dignity?
Mm-hmm. Yeah. Amen. You know, there's a question about whether, thank you, whether Heracles becomes a god or not at the end of the play. And some people believe that he does. They make all kinds of highfalutin arguments as to why this apotheosis occurs, because there's a myth in which at the end of this story he becomes a god, and of course in Athens they worshipped him as a god. Or it could just be a death. You know, and it could be a death like any other human death, not a last labor that proves that he wasn't even a man to begin with. And I you know, this question of, I hear your point about can we eradicate pain and suffering and die with dignity, but I feel the question might also be, or maybe that's not your point. What I heard in your saying was that what I think maybe also be part of this, the challenge of Sophocles is, can we find the transcendent? Can we find the dignity? Can we find what's elegant in all the pain and suffering? And you know, and I don't know if there's an answer, but there's a couple hands, and I'm going to let you take it on.
Thank you. You mentioned dignity, and my question to the panel, that play did not include the actual death scene. And what my question is, in the actual death scene, I am aware that a lot of people will be able to see or hear things without their hearing aids and without their glasses, and they can converse with people just before they die. The other thing that I'm hearing more of now is that people stay with their loved ones or their parents, and they go to the bathroom or they go somewhere, they come back and they've died. And is there a possibility that in death there's a dignity about, I want to die by myself rather than in front of my friends or husband or wife? Has any of the panel heard anything about that?
30 seconds.
Well, just that what I would say, what is one person's death with dignity might not be another person's death with dignity. That's what I meant by profound and profoundly personal. Right. And so I think to be known and to have your wishes be known, whether to have your whole family gathered around you, or I've had experiences with patients where they've wanted to say goodbye and then go off by themselves. Right. And I think either one is dignity. Some people would like to have all pain and suffering eradicated, so like Heracles said he was an animal. I think that meant without dignity. But for some people, they don't want that clouding of consciousness. They would rather suffer the pain and still be alert until the very end. Mm-hmm. It's very personal, and that's why I think it's so important that the healthcare team be willing to deal with people on that personal basis wherever they need you to take them.
So we are at the end of our time, but I'm going to leave one last place for one last person in the audience to answer all 4 questions with a final word. And I knew it was you all along when I started.
When you talked about God at the end, I think we've left out the spiritual aspect, and that's how I would interpret it. God is there at the beginning and the creation, and he's there when we die, and he's God of the universe.
That's a good answer.
Thank you for that, and it's important to hear that. Before everyone leaves, I just want to say 2 quick things before you bolt out. I know you're punctual. One is, If we had one message to deliver to you 2,500 years later from Sophocles, it's simply this: you're not alone in this room. You're not alone across the world. This marks the end of the 20th performance of End of Life. May there be 200 more. Most importantly, if you got nothing from this, I hope that you are not alone throughout time. And that's the public health message behind this project. And that's the healing that we hope to bring. People say, where's the hope in your tragic projects? The hope is in all of you sitting in this room and bearing witness to death and having this open conversation and sharing such personal things. The hope is in you all facing this together and talking about the issues that matter most to you as a community. I want to thank you for being with us this afternoon. I also want to bring your attention to the comment cards, the yellow cards that are in all your programs. They're boxes on the way out. We really value your feedback. So could you please take a few seconds before we leave to fill out the comment cards, give us your honest feedback. We will take it very seriously as we continue to evolve this program. With that, I'd like to thank the Institute of Medicine, Harvey Fineberg, the actors. Thank you very much. It's been a pleasure being with you this afternoon.